This is a cesarean section, also known as a C-section. It is a safe surgical procedure used to deliver a baby through the mother's abdomen, instead of through natural birth. Many mothers undergo this operation for different reasons, such as complications in pregnancy, multiple births, or when labor becomes risky. The mother is given anesthesia so that she feels no pain during the procedure. In most cases, this is a spinal or epidural block, which keeps her awake but pain-free. Her stomach area is thoroughly cleaned and draped with sterile sheets, ensuring the environment is safe and free of germs. The doctor begins by making a small, horizontal cut just above the pubic area. This is often called a bikini line incision because it is placed low enough to be easily hidden. The incision passes through the skin and the fatty layer beneath. Beneath the skin, there are several protective layers. The surgeon gently separates the muscles of the abdomen without cutting them, to reduce recovery time. The protective lining inside the abdomen, called the peritoneum, is then carefully opened to access the womb. The bladder, which sits just in front of the womb, is moved slightly downward for safety. This allows the doctor to clearly see the lower part of the uterus, where the next incision will be made. A horizontal cut is made on the lower segment of the uterus. This is the key step that opens the way to the baby. As the amniotic sac is opened, the waters are released, and the surgical team prepares to bring the baby out. The doctor gently reaches in and lifts the baby through the opening. Sometimes, light pressure is applied on the upper part of the stomach to help guide the baby out safely. Within moments, the newborn takes its very first breath outside the womb. The umbilical cord, which has been the baby's lifeline during pregnancy, is clamped in two places and cut in between. The baby is then handed to the medical team, who ensure the airway is clear, check vital signs, and provide warmth. While the surgery continues, the baby may be cleaned, weighed, and wrapped. If the mother is awake, the baby may be shown to her or placed near her face for early bonding. Once the baby is safe, attention turns back to the mother. The placenta, which nourished the baby throughout pregnancy, is gently detached and removed. The uterus is carefully inspected to ensure no tissue or clots remain. The uterus is then stitched closed in layers using absorbable sutures. This step is very important to control bleeding and to allow the womb to heal properly. The surgeon works layer by layer, carefully restoring the tissues of the abdomen. The muscles are brought back into place. The protective lining is closed. And finally, the fascia, the strong tissue that gives the stomach its strength, is stitched together. To finish, the skin is closed neatly, either with dissolvable stitches, fine sutures, or sometimes small staples. The goal is to leave as minimal a scar as possible. A cesarean section is a major surgery, but with skilled hands and proper care, it is a safe and effective way to bring life into the world.